Viruses are very small, smaller than bacteria. They cannot be seen by the naked eye or with a light microscope, the microscope in your doctor's office. To see one, you need an electron microscope. In transmission electron microscopy, the sample must be made into extremely thin slices before imaging so that the electron beam can pass through the slice rather than skimming over its surface, allowing for the necessary details to be seen. A virus cannot reproduce on its own. It needs a host cell. It invades the susceptible host cell, takes over the cell's machinery, and forces the host cell to produce many more viruses. Viruses come in many shapes. Some are cylindrical. Some are shaped like gemstones with sharp spikes sticking out from their vertices. Some viruses are bullet-shaped. Some are kind of wormy looking. Many are spherical with spikes sticking out of the sphere. There are many more that are not shown here. There are some that look for all the world like spaceships. The image in blue was provided by scanning electron microscopy. The Ebola virus is a filamentous virus which sometimes forms a shape like the number 6. This is shown above with an electron microscope. The Ebola virus can also look like a shepherd's crook. This virus is part of the filovirus family, one of the 4 distinct families of hemorrhagic fever viruses. The multitude of spikes projecting from the spherical coronavirus are said to be like a halo or corona. Think of the corona formed by the eclipsed sun. In people and animals, many viruses bind with the cell membrane and then are absorbed into the host cell's cytoplasm. How do viruses differ from bacteria? Both are common sources of infection. However, bacteria are much larger and can reproduce independently. A virus cannot replicate without invading a host cell. Individual viruses have evolved to be pretty limited to specific hosts. That said, there are a wide variety of viruses. They invade plants and animals. Even bacteria are not safe from invasion by viruses. A virus that invades bacteria and then replicates within is called a bacteriophage, or simply a phage. Phages are the ones that look most like the lunar landing module to me. Fun fact, and a tool for remembering their function, bacteriophage actually means bacteria eater. Bacteriophages penetrate the relatively tough outer coats of bacteria and inject their genetic material inside. Once inside, it then reproduces using the bacterial cell's own machinery to make many more of itself. Eventually, the cell lyses, or bursts, and the new phages are released. Unlike the bacteriophages that poke a hole in the bacterial cell wall and inject their contents inside, coronaviruses use the projections on their outer sphere to attach to reciprocal projections on the surface of cells. In this way, they trick the cell membrane into absorbing the virus into the cell cytoplasm and release new viruses by a budding process in which they carry off patches of modified cell membrane, surrounding themselves with this membrane for protection. Many other viruses also modify pieces of the host cell membrane and use it for protection. In any case, no matter how the cell is invaded, no matter how viruses are reproduced and exit, the end result is the death of the host cell and the release of an army of new viruses. The novel COVID-19 coronavirus strain is more complex but follows the general process depicted here. After entering the cell, some viruses begin to copy themselves right away. But other viruses can quietly insert themselves into a cell's genetic material and are reproduced when the cell replicates. I say quietly because the virus will be relatively inert during this time. Sneaky, huh? How are viruses detected? Sometimes the effects of the virus on a patient's skin or in the body produce characteristic signs that tell the medical provider what's going on. Think of herpes or chickenpox. When the virus has commandeered a cell, it causes gross distortions in the cell's appearance as it warps the cell to do its bidding. Sometimes it is the distorted cellular appearance caused by viruses invading tissue cells that pathologists can readily see under the light microscope with the assistance of stains or dyes. Some viral diseases can be identified by the distinct ways in which they distort the invaded cell. As mentioned before, many viruses can be viewed with the assistance of an electron microscope. Some of the characteristic shapes mentioned above can be seen this way. Viruses can also be detected by identifying the antibodies the body has produced against them. This is simply known as an antibody test. The virus can be detected by antigen testing, which detects the presence of certain unique proteins, antigens, on the outside of a virus-infected cell. The genetic material of a virus, either DNA or RNA, can be isolated, amplified by culturing, and detected using chemical probes. In order to see the antibodies, antigens, or other viral proteins, we may add solutions made from known materials, say antigens or antibodies, to samples of the patient's blood, saliva, or tissue, and watch for obvious changes to the sample. We may see a color change or a clumping of material in the sample. The known materials may be chemically modified or tagged to assist this visualization, or a special light may be used which causes the positive samples to fluoresce. The latter process is often referred to as immunofluorescence. Why don't antibiotics work on viruses? Antibiotics are designed to work against bacteria. They may destroy a bacterial cell wall, interfere with bacterial reproduction, or interfere with bacterial proteins. Antibiotics are made to attack bacteria. They are not effective against viruses, notably because viruses do not have cell walls for the antibiotics to destroy. Some viruses are strongly linked to the development of cancers. They cause cancer by inserting themselves into the cell's genetic material in such a way as to disrupt the cell's normal rates of division, causing unregulated growth of cells. Certain human papilloma strains, for example, cause cervical cancer, and hepatitis B and C viruses are associated with liver cancer. Many viruses can be treated with antiviral medications, but not all. These medications can work in a number of ways at various points in the virus reproduction cycle. For example, they might block virus DNA or RNA reproduction, or they might inhibit the ability of a virus to escape from its host cell. The goal of these medications is to prevent the viral load from increasing to the point of a diseased state, and then to let the body's natural immune system neutralize the virus. Even when antivirals are available, they are only prescribed to a limited degree. This is because they are often toxic to the body's healthy cells. Also, the medical world has now experienced increased bacterial resistance to antibiotics to an unfortunate degree as a result of the overprescription and overuse of antibiotics. Today's doctors are concerned that the overuse of antivirals might result in viruses resistant to antivirals as well. Therefore, doctors weigh the benefits versus the negatives before prescribing antivirals. The antiviral may be prescribed only if the patient's medical condition requires a more aggressive treatment. The patient's age may be considered since the body's natural immune system tends to be more vigorous in younger individuals, but declines with age. Antivirals are most effective within 48 hours of initial infection, so time elapsed since infection onset may be considered. If the antiviral is highly toxic, the provider may consider which is worse, the disease or the toxicity. A vaccination works against both viruses and bacteria. Each vaccine is developed to fight a specific virus or bacterial infection. There are two main types of vaccines: live attenuated vaccines and inactivated vaccines. Live attenuated vaccines contain the actual or a weakened version of the virus or bacteria. Once the immune system is exposed to the vaccine, it will chemically remember the organism for some time afterward. The body can remember for a lifetime, but the problem is some infecting organisms change so rapidly that what the body remembers can become quickly outdated. How long immunity lasts with a vaccine depends on how rapidly the disease organisms change their structures. Influenza, flu, changes every year. In fact, at any one time, there may be several variations or strains of the flu out there. So each year, several different strains of influenza are addressed by one flu vaccine. And to keep your immunity up to date, you must receive a new flu shot every year. Coronaviruses have also been around for a long time, like the common cold. However, the pandemic of 2020 was caused by a novel strain of coronavirus called COVID-19, for the exact strain that developed in 2019. It often presents in patients as something much more severe. The best way to beat a virus at its game is not to play. Wash your hands. Practice social distancing. Wear a mask. Clean surfaces frequently.